mean, it's so yeah, I guess of course it's
Welcome, everyone. Good to see everybody. Glad to be in person. Thanks to everyone for rescheduling. We had a number of issues for our last meeting and we weren't going to be able to have a quorum, so I'm so excited that we were able to reschedule and have everyone here this evening. So I'm going to call the meeting to order. And thank you again to Jody for keeping us on track and for your exemplary minutes and everything. And I'll turn things over to you to call the roll.
Welcome, everybody. We'll start with Dr. Krista Jones.
Here.
Dr. Brent Reifstead.
Here.
Do I say that incorrectly?
Reefstead.
Reifstead. Thank you. Okay. Ms. Kathy Emanuel is absent today. Mr. David Bees.
Here.
Dr. Dorothy Vera-Weiss.
Here.
Great. Dr. Peterson.
Here.
And Dr. Goodley. Dr. Hick.
Here.
And Mr. Mike Ingram.
He will be late.
Right.
He will be late, and Dr. Goodley, I think,
Yeah, they're both about 10 minutes late. So I would entertain a motion from anyone on the approval of the agenda as presented to you. So moved by Dr. Vera-Weiss. Do we have a second? Seconded by David. Anyone have any concerns, any questions, any issue discussion on that? Hearing none, all those in favor?
Aye.
Anyone opposed, any abstentions? Thank you. Our next agenda item is the approval of the minutes from our last meeting on December 5th. I'll entertain a motion to approve the minutes.
So moved.
Thank you. Moved by Dr. Peterson. Seconded. All those, I'm sorry, is there any discussion on the minutes? My apologies.
I do appreciate the gesture, and my degree actually is Juris Doctor.
I
but
know,
probably
she
shouldn't
was-
be referred to as a doctor. I am just David.
I noticed that also. And I was thinking that the actual, if we're gonna do it, that maybe.
MD, PhDs.
Yeah, MD, PhD, DVM,
Yeah.
DDS, or DMD, you know, all of those things would be really useful. And if you don't have all that, okay.
I just, if that's how you want it called, that's what we'll do.
Well,
In the
there
minutes.
is actually a significance because our bylaws or the law requires or asks us to have a certain doctor, dentist, who's even a lawyer.
Two doctors and one dentist.
A lawyer isn't, but we always like
I
to have
always
a
like
lawyer.
to have one,
We
so
can have one.
it creates confusion if it looks like I'm fulfilling the doctor role, because I'm not.
Yeah.
And mine's in nursing practice, so that's also has to fulfill. We have to have a nurse on the
So titles do matter in this respect.
I'll go ahead and, would you like me to correct the minutes?
Now, leave it in there once, so, you know, the archives will show me one time.
Well, you are. You have to be.
He had the doctor withdrawn.
Okay, whatever.
Thank you.
Going forward, I will do that.
Okay.
Thanks. Any other comments? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? The minutes are approved. Thank you. Public participation on our agenda items. Do we have any public participation on agenda items? Thank you. We'll move on to correspondence and communications. Julie?
I don't have anything specific unless you want me to bring up and Kathy run that with us. No, we'll let that be brought up and if they want to come do it. Let's see. Nope, I don't have anything.
And just so everyone's clear on the thing Kathy brought up, is this the discussion about the closure of long-term care facilities in Champaign County, particularly the Champaign
wasn't
nursing
talking
home.
about that.
Oh, I thought that's what you were talking about. My apologies.
Sorry, no, I'm just talking about the other issue.
Oh.
Somebody wanted to change one of our policies, and I basically said they can come bring it up to the board, but it's, that's a kind of a big deal. Regarding the nursing home thing, that's the county's. I don't wanna get involved in that, that's not our, what I had offered to do was to do maybe we'll do a community scan or a community needs assessment, because it's not just the county nursing home, there is a very much of a shortage of beds in this community. Meadowbrook has some beds, closed right now, there's just it's a lot of.
So it's, they're saying that there's a surplus of beds.
Yeah, who's saying that?
The nursing home that's
Yeah,
closing.
there isn't. We have a desperate need for them as far as anyone I've talked to. But we can do something like official to find out how many beds are actually available in our county, or at least we can try to do that. We can try to do something. A couple of months ago, I had a grant where I could have done a community, basically a community needs assessment for all senior needs. I thought it would be a wonderful thing to do. I sent it out to all the senior service agencies. I didn't get a lot of response back, and I really needed the partnership to be able to go for this grant. So it's something I will try to approach again with it, because
That's a great idea.
yeah, because when we have our community needs assessment in our I-plan, it's just a big picture, and there are times where I think that we need to dig down. We've done them for different populations before, and we certainly need to do that for senior services right now, because we have there's a really good group out there doing senior services right now, but it needs to expand out to all of the things. We need to find out what services are here, and because when I read in the paper that they couldn't fill the beds, it was like, what? How does that happen? That's just that makes no sense to me at all.
Well, Julie, it might make sense to coordinate that through the county executive's office too.
Yeah, that's a good idea, because and all the different groups, because I would need help to do that, so it's not gonna be something that we can just, do tomorrow, but yeah, I will talk to them and see what kind of, if we can help in that sense. But she was wanting to form a committee and do all this stuff, and I'm like, nope, we don't want to get in their way on that. We will do what we do, provide data and provide whatever help we can like that, but we have no role, in my opinion, to be involved in the decision making.
And probably everybody's aware that the reason they said it was a surplus of beds is because their own beds aren't being filled, because nobody wants to go there, and therefore they're going to places way out of town.
I agree with that.
And I believe that they purchased and then closed another nursing home with the same situation that they, when they bought it, it was decently run and they weren't providing good service, they lost patients. And so they're saying, look, we keep seeing that one nursing home after another.
And yes, and that is a tactic.
Yes.
That is a tactic that some places do when they buy long-term care or substance abuse treatment facilities or hospitals or any number of things. It's a tactic. It's not an ethical one in my opinion, but apparently it's a legal one. But because it's not only that nursing home that's gone, but the Inman has changed now. It's no longer what it used to be. And we need beds, and we certainly need Medicaid beds. But I will look into doing something with that.
And the other issue, I don't know if anyone here was contacted, but there was a business owner that has contacted some members of the board to discuss the potential of an appeals process change. And so I forwarded that off to Sarah, sent an email about that, and invited that individual to come to tonight's meeting to present whatever information they want. And so we haven't seen anything, but just communicate that.
You can't at the end of the meeting, public participation for things not on the agenda, is that right?
That's my understanding.
Maybe that's why it's not here.
Yeah, that could be, because it's at the
I think it's worth talking about.
It is, but it needs to be done in an open meeting. I told her not she was wondering if she should go meet with them, and I said, no, don't do that, but. we
I
have
think
a-
we all got a phone call from it.
Sarah's been here, what, 30 years? And that.
Not quite, but yes,
And
close.
apparently there's been one appeal, or maybe two in that entire time.
Yeah,
I was in the one I know about, so if there was one other one.
just one other.
And it's it's pretty cut and dry. I went into it and I had the attorney there, and it was that person, their attorney. And, it was sort of a yes or no kind of question. Either you did this or you didn't do this, or, type of thing. Or you're going to do this or you're not going to do this. So it's not really, it's definitely not on our radar as an issue that needs to be changed. So, because it's very seldom used, and we want the district and the county to have the same policies. And then if we're gonna ever change it, then we need to get both of the boards together. So that's why I told her just to have them come and present it at the meeting. Or write a letter, but something that's like public. A letter's works too.
He told me he was coming tonight.
I'm sorry?
He told me he was coming tonight.
Okay.
Anything else, any other questions related to correspondence and communications? Hearing. Good to see you, Lyndon. We're right now at Smile Healthy Report.
Oh, fantastic. I'm smiling, so we're good.
All right, that's what I like to see. So we have a Smile Healthy Reports for December 2022, January 2023, and February 2023. So I would entertain a motion to place those on file and to approve. And then a second, and then if there's any discussion, we'll be open for any discussion. We do have.
So moved.
Second.
Moved by Lyndon, seconded by Dr. Vera Weiss. Open for discussion. Any comments, questions?
Just a question. We had talked last time about the search for some hygienists. Did those get filled?
We have recruited one, we are recruiting, we are trying to recruit an additional hygienist. We have one right now that is practicing though, and one will be joining in a few months. Our new operatories are functional, so we have room for more dentists. So we're heavily recruiting both dentists and hygienists.
Yeah, just to follow up, so I think several months ago, last year, we awarded approved to be a different way of recruiting dentists and hygienists. Is that correct?
Yeah, you provided some financial support for us to help us be more competitive in providing some recruitment incentives.
Is that working for you? Is it working well? Need more money? Less money?
Do we need more money? Yes, it is working. I feel like it's giving us an extra boost to be a little bit more competitive. We were able to offer a bit of a bonus to our recruitment kind of bonus to the hygienists that we did recruit earlier. So I do think it's much appreciated, and there is just, we get probably 10 times the calls for Medicaid dental than we do for the entire clinic. So there is just a crazy need.
And would you say that predominantly,
Go ahead.
would you say predominantly that need is within the county jurisdiction or within the cities of Urbana and Champaign?
I think it's a mix. We get calls from all over the county. A lot from Rantoul, especially.
Two things. One is I had a question about the numbers on here.
Okay.
As I was looking at it, I thought that the months, 3 months were each the same, and this shows them doing off, but I don't have my copy with me.
December was 4,166. Is that what you're talking about?
Yes.
Yeah. And then the other two are 6,416.66. Is that a typo or is that real?
I think that's real.
Okay. And I misread it.
I'll double check it though, but I believe that is, because I noticed it too.
And then the other thing is that looking over the procedures that were performed, it's really clear that most of it is one kind of prevention or another. That it's prophylaxis, it's fluoride applications and things like that to a large extent, and there were relatively few extractions. Although I realize that in a pediatric population, I don't know whether giving a little extra help to a tooth that's planning to come out and help being replaced by a secondary tooth, whether that's considered an extraction that doesn't rise to that. But anyhow, it really is prophylactic in one way or another, and so it really is public health prevention.
Mostly the teeth that being extract, if it's a child, usually because it decayed so far, to be saved. Whether it's the primary teeth or permanent teeth, if you go in there and you take the tooth out, it's an extraction, regardless. You don't, sometimes you do for preventions only if it's issues of crowning, teeth are coming in like multiple rows, and then you do extraction to encourage the teeth to grow in the right place. Yes, and that would be prevention.
Thank you.
Any other questions? Hearing none, we have a motion on approval of reports, which is A, B, and C. All those in favor?
Aye.
Any opposed? Any abstentions? I'll move us then to the invoices. So in the invoices, D, E, and F, we have the invoices for the Child Dental Access Program. Those are listed there, and then subsequently we have invoices for the monthly bills for November, December, January, and February. So I would entertain either a motion for all invoices, or we can separate each of those out into two separate motions, if you wanted to have further discussion on any of those items.
Do the all ones.
So moved. Second.
I'm sorry, who
It was moved by David and seconded by Linda.
Thank you.
And that would be for all invoices, so items D, E, F, and then under CU, PhD, A, B, C, D, or A, B, C, D, excuse me, invoices for the months of November, December, January, and February. Any discussions? It's been moved and seconded. Any discussion on those invoices? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. That then takes us to the monthly reports, communicable disease morbidity, and monthly reports for CU PhD performance management. We usually place those on file on the website. So I would entertain a motion to place those on file. Those are your items 44 through 54.
So moved.
Moved by Dr. Bureau-Weiss, seconded by Dr. Hick. Any discussion on those monthly reports? Hearing none, all those in favor?
Aye.
Any abstentions? Any opposition? Thank you. Any old business? We don't have any listed on our agenda. Other business, update on Making Proud Choices program from Whitney Grigger, Director of CPHD's Wellness and Health Promotion Division. And Whitney is at a conference.
Yep, so I have it right here, her report she sent to me. So everything has been going well, no issues at all, good, which is awesome. At JW Ader in Rantoul, they have completed all 8th grade. They had 6 cohorts, 174 students total. Fisher High School, they completed 1 cohort in December with 24 students. and another cohort in May to be announced, the number of students. Total lessons per cohort 4. And then Fisher Junior High is still in progress. They haven't finished up, they're wrapping up, but they haven't finished up. In progress, 1 cohort with 26 students, and they are using the full Making Proud Choice, oh, sorry, I forgot to say that. J.W. Ader and Fisher High School are using the full Making Proud Choices curriculum. And she didn't say that with Fisher, but I don't know why they wouldn't be. That's the curriculum we use, but for some reason it doesn't say that. So she said as of today, there are 224 students with 1 additional cohort still to count. So they're going well. It's a very popular program. It's popular when we do it in Champaign-Urbana, and it's popular in the county as well. So.
Question, did she say anything about parents refusing their child's participation?
She didn't say that because they just get the cohort. So if parents don't sign up for it, then they just aren't there. So I didn't ask her, but she said there's been no complaints, no problems, no issues brought up by administration or the teachers or anything. So the schools that we're in are schools that wanted us in, so that helps. I mean, if they come to us, that's helpful. And that's the update. On my phone.
Any other questions for Julie? Our next agenda item is approval of sub-grant recipients between CUPHD, the County Board of Health Department, and CUPHD. And those are items 55 through 93. So the first is between the 2 entities. And I know, Mandy, this has been some ongoing conversations between the county and CUPHD and with the management of the county public health department. So I'm wondering if you can speak to some of why that's occurring now.
Or if you want me to. I mean, you want me to? You can if you want.
You can,
You can if you want, but I so what it is these are grants that are going to the county that CUPHD does. And so they need to be able to show in a meeting that these were accepted by the board or accepted by, somebody other than us, so that when they go to pay it and then when they do the audits that they have that. So it's like a paper trail. Does that sound right? No numbers were involved, so I'm fine. As long as no numbers were involved, I can handle it. So anyway, that's what it is, and then at the last, and then who put this together? This is fabulous.
Oh.
Yes, that's nice.
So this shows all the different, these are just different grants that are.
It's a lot of money, by the way.
Yeah. Yeah.
Wow.
Yeah, oh yeah, our budget is mostly grants and contracts, more than tax dollars or anything else, has been for 15, 20 years, for sure.
Which is fantastic, so it's less reliance on that,
Yeah.
as a source of income. And
We have definitely diversified the funding stream, so, which is helpful. But, so anyway, we have this grant, and it is a COVID vaccination grant, and luckily, because you're the county and we're CUPHD, oftentimes we get 2 grants. So that's a good thing. So if you're DeWitt Hyatt, you get 1 grant. You have 2 counties. You have 2 health departments, technically, so you get 2. So if there's a base grant and the money on top of that, based on population, we still do better because we have 2 health departments. So we get 2 base grants and then the population, as opposed to 1 base grant and the population. So, yay. Yay
There has
us.
been talk about,
Yay us.
yeah, there's been talk about combining the 2 departments. It never went very far, but
Yeah.
there actually is some benefit not to doing that.
There's a lot of benefits, but yes. So anyway, that's what this is that this is a grant to provide, it's an immunization grant. It's to help us get immunizations out there. So it's Mpox, influenza, COVID-19, you know, now, y'all know that 65 and up can get a booster now, right? A second COVID bivalent booster. So we're gonna hit that pretty hard with the media here soon, make sure that, we're gonna check with all the long-term care to make sure that they're, understand that, and that they can get their people in or ask for help.
Is that the same bivalent booster that we had?
It is.
Is it?
It is, so I think what's gonna happen, and again, this is just based on, you know, we don't have anything official, but this is the exact same bivalent booster, they're just getting another one, so that it is boosting it. So that it's giving you another
Well,
fire in the pump
it
again.
doesn't last.
No, it does not last, right?
Yeah.
But the next one that's coming out, hopefully, will, in the fall or winter, hopefully, would be one that will have more updated strains of what is going around and what they're concerned about, like they do with flu. I know that there are new companies even working on them, which I was kind of surprised by. And they're still working on, you know, it's just like all the vaccines, they do different things. There's a place still working on the nasal spray and different things, so. But right now, we will talk about that because we don't get people excited, but the new booster that you can get is the same booster you had before, just to get you through another period.
My card says I got one in October of 22.
Yeah.
Is this a new one since then?
Yes. It's the same vaccine,
It'll be
but
my
it's,
fifth shot.
it'll be your fifth, correct?
Because I haven't done it.
Yeah, it'll be your fifth,
Are they
that's
available?
right. You had the first two,
Yes.
and then you had the second two,
No, the
wait,
second one was a third shot.
yeah, this is the third,
The fourth one.
the fourth booster was the bivalent. The fourth one was bivalent, and then the fifth one is the same bivalent, just at a later
Are they
time.
available now in the drugstore?
They are.
Yeah.
Yep, you can get them at pharmacies or wherever, and you can get them here. I'll have the number. We haven't sent it out yet because since we're mostly dealing with seniors, we wanted to make sure we had a line for people to call in and not mess with the computer stuff, because that's
Well,
not.
I'm a senior. I became a senior.
Well, you can, and you know how to use a computer too. So some seniors like the computer thing, but not everybody
Oh,
does, so.
okay.
I think that you can also get it if you have immune suppression issues and different things
Yeah,
as
yeah,
well, so.
like before.
Mhm.
Yeah, just a question for, from a public health standpoint, are we still looking at, COVID as a pandemic, or as a non-endemic, or what's?
Well, that's a really good question.
You just answered that
I
question.
did just answer that in the paper. I get that question all the
I
time.
missed it.
It's technically still a pandemic. The World Health Organization, pandemic just means, you know, worldwide spread. So it
Right.
still is spreading, you know, worldwide. It's endemic here, and
Yeah.
it's just gonna keep
Sure.
here, but hopefully those little flips will get smaller and not quite so dramatic, and then probably it's going to go to be one of our winter, you know, viruses at some point, just like it does, and probably eventually it will become like the common cold, like the other COVIDs did, but that'll take a long time, but the original COVIDs probably started out, you know, like that we are now colds, they probably were pandemics at some point in time. But yeah, so it's endemic here, it's not going anywhere unless, you know, and the only way that it would, you know, make me immediately retire is if it mutates in such a way that it starts over and we have to start everything over. But I don't look for that, because I have to sleep. And so I don't think about that. But I do think that we're on the, it feels a lot better, let's say that, and I'm sure people working at the hospital are like, thank God. Is your question?
Yeah, I have a question on the grants, on this wonderful listing here. There are two of them that involve Helena Health, one for community resilience, et cetera, and the other dealing partially with immigrants.
Wait, which one, I'm sorry?
Okay, it's the fourth and then the second one on the second page.
Okay. And what's your question?
Who or what is Helena Health?
Let me think about this for a minute. What is that? What is that one? That's a candy one. No, it's,
Helena Health.
hold on, I have to think about this for a minute. wellness and health promotion at MCH. Oh, I think that's the Arise grant. Is that the Arise grant?
I'm not sure.
Yeah, I think it is. It is, and so's the other one, yeah. Those are working, the second one is the Arise grant. These are specific, grants that we have. They're federal grants that are going through this company or agency, but they are grants, specific to working with immigrant, they call them RIM populations, refugee, immigrant, migrant populations. I find that an unfortunate acronym, but whatever, that's what they call it, RIM grant.
Okay, so they're, just SU PhD is listed as a party to the,
Mhm.
they are actually doing the work, or they just access the funding from somebody else?
PhD or
No, they
Alumni
don't
Health?
have.
Alumni Health. You know, I don't, honestly, I have to look back at that one, I don't know, I know where they came from, we're in the cooperative through like NACHO, so it's whoever, that's who we're working with on that, so I'm not sure, you know, how they did it through that, but I'm gonna have to ask. Yeah, I'll ask Whitney on that, but that's what they're for. They're actually really large grants, and they're, in fact, that's probably where Whitney is right now, just working on one of those. Because they have conferences associated with them and trainings and things, so they're.
I mean, the purpose of them looks very important, and so.
They're all about, this is like hidden there, but that's an equity grant. That's really what it's about. It's to make sure that we're getting everybody served, which we already did, but if you want them some money to serve them again, maybe we have to. Keep serving.
Yeah, it looks like they're, a grant distributor. Their program been partnered with a number of different grants, from everything from family health support to health equity.
Yeah,
And chronic disease.
it's all health equities
Yeah.
based stuff. And it is through, NACHO was the ones that we were working on originally to get that, but I don't know. There's probably a lot of places, ADHA and all kinds of places are working with
All right, any other questions on the sub-grants? So we have two line items here. We have sub-grant recipient, or sub-recipient grants, between the county and PhD, and then approval of the sub-grant, sub-recipient grants, with the agreement with the State of Illinois Department of Public Health not to exceed $175,000 for the COVID-19 vaccination grant, which will help defray costs associated with the administration of COVID-19, Mpox, influenza, and other vaccines recommended by the Advisory Committee on Immunization Practices. So again, and similar to what we did before, we could take those together, or we could separate those out if people would like to discuss those in more depth.
I don't have any other questions, so I do it together unless somebody wants to talk about them individually. So I move both, the approval of both.
Moved and seconded, any discussion?
I'm sorry, who was the second?
They're good.
Thank you.
And we'll be having, these on all the other ones. Anytime we get a grant now, it will be on there. We'll still accept the grant, but it will still come on here to be approved, so that they're public. So, hopefully we'll be getting more of them. Any other questions, comments? Hearing none, all those in favor?
Aye.
Aye. Anyone opposed? Any abstentions? That takes us to public participation on non-agenda items. Do we have any public participation on non-agenda items? Hearing none, is there, for the good of the order, any additional questions?
I have a question, or I have a suggestion. Would anybody object if we, next meeting, put these two tables this way? I'm hearing 50% of what you are saying. This room is really bad for, you
Yeah,
better
well,
get microphones.
we can-
Especially, and I love for Dorothy to wear a mask, but I didn't hear a word you said tonight.
I'm sorry, I just got back from some
No,
travels.
I don't mind at all, I get it. But if we could move it so we can be across from each other?
Yes, we can,
That would be
we can
great.
rearrange it. It's, when we do it, we have it set up like this for our board meetings, but there's only 3 people on there, so it's not a big deal, but yes, this is different, so yeah.
They don't like each other, so they can't.
Well, we were kind of rolling ourselves out for COVID there for a while, so we're gonna.
I think it would work if we just
Yeah,
made
we
it
can-
maybe you.
Yeah, we can do
Yeah,
that.
I'm good with
That's
that.
how we, that's how
I
we
usually
used to
sit
do
over
it.
there, so I was like, oh, where am I?
Yeah, and we'll do it that way, and what was I gonna say about the other thing? Is there something else about that, about the room? Oh, we have microphones, and they just don't work. We have looked and looked and tried to get microphones for this room, we have a real hard time with it.
You need to get a grant for this.
We've looked for all kinds of fancy little things, but they're all wireless microphones and they just don't work. So
Wireless.
either the technology hasn't caught up to be great, or maybe we'll use a room grant for that.
Ending on that, our next meeting is June 20th at 5 p.m. back here at the Public Health Districts. Our meetings are in person now, the main conference room. I will entertain a motion to adjourn if there's nothing else.
I won't be here June 20th, so just.
Oh, that's a good question. Will everybody be here on June 20th?
I expect to be,
I may not be here. I have a meeting out of the county.
now we're having trouble.
We can send out a thing, and we can send out a survey.
Yeah, I will not be there if it's that day.
Okay, well,
Unless I can come in by Zoom. I'll be in Missouri. That's fine.
So let's check with Kathy too to make sure, 'cause that would give us 1, 2, 3, 4. We have just enough for a quorum, but the other 5 of us, but let's
Sorry.
check with Kathy. And then if she also can't be, then that's a pretty good portion of our board that can't make it, and so maybe we need at that point to reschedule it as well.
I will just mention, I will not be here.
Oh, geez, now we're really getting down to that.
I'll have to convince Amy to come do this.
So,
Should we
okay,
just,
so I.
should
while
we just go to
everybody's
the
here-
August meeting then? Should we just forget about June and go to August?
We have, board positions, there's certain things that have to happen in June. I'm thinking, okay, so I'm pulling up my calendar here, give me a sec. What are the dates in June? Okay, so there's June, that would be the 13th, right, so week before, am I correct? Would you prefer to do June 13th?
I can do the 13th, but I know I'll be out.
I can do the 13th.
I can make it.
Done.
I'm okay with 15.
Okay.
You're giving up your practice. We can point you to everything.
Right.
Oh, wait, are you
All kinds-
retired, Kevin Peterson?
All kinds of
Yeah,
stuff.
I am retiring,
What? Congratulations! That's fantastic.
sort of. I mean, I'll do volunteer work, but yeah, I'm closing a small business, which is a lot of work.
Yeah. Congratulations.
That, what I do is now available in primary care, and we've been successful in moving about 200 patients into primary care, so that's where it really does best. So that's what I'm up to. Yeah.
So that's the substance use practice? Is that the substance use practice?
Yeah, buprenorphine, yeah, opiate dependence.
You've been an important part of our community.
It's, yeah, we have, probably in terms of all specialties in medicine, although it's often hassled by federal and state authorities, it has the largest bang for the buck of anything anybody does. The average life expectancy of a heroin addict in 10 years is only 50%, and we changed that dramatically.
Congratulations, thank you for everything you've done, absolutely. So I will entertain then a motion, just because we voted on the meetings before, so we're changing the meeting. So do I have a motion to change the meeting from June 20th to June 13th? Moved and seconded. All three of them raised their hands there, so pick two.
All
I'll let you.
Let's fight over
Love
it.
it. Love it.
All right, moved and seconded, any further discussion? Hearing none, all those in favor of moving the meeting from June 20th to June 13th?
So moved.
Aye.
So approved.
Anyone opposed, any abstentions?
Okay.
Thank you.
Thank you.
Now I need a meeting to, or a motion to adjourn, so sorry.
So moved.
Second.
Okay, moved by Dr. Peterson, second by Dr. Weir Weiss. Any discussion? All those in favor?
Aye.
Any opposition?
Thank you.
Any abstentions? Thank you guys so much.
It took so long to have this meeting, it was more than a chance to have.